schedule. Visit wholesalesupply.us to find a location near you.
If you have kids in school, no doubt you're thinking about the flu that seems to be hitting everybody so hard right now. So it's a great time for us to have Dr. Stephen Miller back on the show with the Hamilton County Health Department. Good to see you.
Hey, it's great to be back.
Is this surprising you, what you're seeing with these numbers?
I'm surprised that it's still climbing. We're still seeing the secondary spike of the flu season, and at this point there's no end in sight. So I'm wondering if it may still continue to climb for the next couple of weeks.
You know, I can think back 20 some odd years in my life to when it first became a thing, at least in my memory, where workplaces would have flu clinics, flu shots, where they would come to work. And it seemed to happen at a certain time of the year.
Sure.
And then it wasn't long before it was happening kind of almost an ongoing thing, that the flu season never really ends. There is no, quote, season.
No, and here we'll have a delay behind other major cities like Atlanta or Chicago. So it's not uncommon for February, March to be our flu season when other cities have already had it a month ago. And it's not uncommon to still find cases of flu in even April and May.
Why would that be? Why are we a month or two behind somebody else?
A lot of it is travel and influx. We do get it earlier now because Chattanooga is becoming more metropolitan. So we have a lot of people that are going out of state, that are going and commuting to other bigger cities. They're flying to other places and they're bringing it back more. But it's still, in some ways, we're rather provincial.
Okay, so probably this could be like the coin toss at a game. We can flip the coin and 50% of the people roughly are getting that shot and 50% are not?
It feels like it's that percentage. It's definitely lower than it has been, and that makes a difference. And we're seeing a lot less of the children getting the flu shots. I think going forward, the further we get away from things of the past, we really need to start thinking back to getting the basic immunizations again, and one of those is the flu shot.
What are those numbers exactly? Do you know the percentages of people getting the vaccine versus not?
I know that it's less than 90%, and we need it to be over 90%. And in some cases in the children, it's less than 70%. It just depends on what areas of the county you look at and what areas of the state you look at. And remember, we visit our families in other states, we visit our families in other counties, so we have to think on that, reflect on that.
So you have these clinics in schools, and you were telling me that in some cases you're seeing 120 kids a day?
Some of our clinics are seeing over 100 children a day with flu-like illnesses, and they're missing school, and as a result of that, they're falling behind in their studies. It's something to think about.
Okay, I'm pressing you a little bit, but you're saying some things that then lead me to another question.
Sure.
So you said you're seeing 100 kids or so a day with flu-like symptoms.
That's true.
There is a difference in a flu symptom and a flu-like
Sometimes they don't
symptom.
test positive for a few days for the flu, and sometimes they have something else going on. We have parainfluenza out there, we have mycoplasma, we have other respiratory infections that are kind of going on right now as well. But
Okay.
definitely influenza A is the predominant one.
You, for reasons you can explain medically and scientifically, you're kind of encouraged, if that's the right word, because you say the strains you're seeing as the predominant types of the flu
Sure.
are the very strains that were in this year's
The
vaccine.
two main strains that we've seen that everyone's coming in with were the two strains that were covered by our flu shot. Sometimes our flu shots don't have the best coverage, but this time they were tailored. It was right on the head. So if you had gotten the flu shot, it would definitely have protected you much more against what everyone's experiencing right now.
Totally a right turn of our conversation right now, but dispel a potential myth for me.
What?
If you are a person who takes a lot of antibiotics, does that make you more prone to develop illnesses? Does it lower your immune system when you take a lot of antibiotics?
Well, it can. It can certainly make you more prone to gastrointestinal illnesses like C. diff. It can certainly make you more prone to certain urinary tract infections and things like that. But you're absolutely right. It's not good to take a lot of antibiotics. It does eliminate a lot of the normal healthy flora that we grow on our skin and our body to protect ourselves from infections.
So from like giving advice to people, obviously with this flu situation, wash your hands.
Wash your hands.
If you're cover your mouth and your nose when you sneeze
Sure.
or cough. If you're feeling sick, just stay home.
Yep.
I guess that's right.
And a lot of times you're a physician or a practitioner, they're going to prescribe you just some rest and some over-the-counter cold agents instead of an antibiotic because exactly what you said.
So
You're creating
don't go
stronger
pushing
strains.
it.
You can cause side effects such as vomiting or allergies. So many people are allergic to penicillin. We don't need to use these antibiotics unless it's absolutely necessary.
So just be mindful of that because the flu is a virus.
The flu is a virus. That's exactly right.
Can you ever over-rest? I mean, can you overstate the power of resting and sleep when you're sick?
I would say no, because in our
Me
culture,
too.
we just go, go, go. We don't know how to rest.
One of my children had the flu one time. It's hit my family once. And I think it was like having a newborn. She slept all day long. But obviously that's what your body needs.
It really does. It
To
needs
recover.
time to recuperate.
Do you like Tamiflu?
I do. There is a use for Tamiflu. It does eliminate some of the more tougher symptoms. It does reduce the number of days you do it. But once again, I like to reserve that for the worst cases or maybe the people that are more susceptible.
Okay.
Like anything, if you overuse it too much, then it becomes ineffective for the population.
I know you have lots of offices around the viewing area. If anyone's watching and they think, you know what, I better get that flu vaccine, can they come to you to do it?
We still have lots of flu vaccine, and
Okay.
you know what? It'll give you protection within a couple of days and maximum protection in about 10 to 14 days. So if you're worried about getting the flu and you haven't had it yet, it's never too late.
Spring break's coming up. A lot of folks traveling for that.
I wouldn't
so-
want to miss my spring break.
All right, here's where you will find them. This is just one of the many things that they can help you with at the Hamilton County Health Department. Their main office there on East 3rd Street. But if you go to health.hamiltontn.org, there you can see all their locations around town. And if you have a different type of health condition and you'd like some help with it, I'm sure that they can help you with it. Great to see you.
Thank you.
Your child could shine as a Local 3 junior forecaster. Wednesdays at 5:30 on Local 3 News. If they love the weather and can read on camera, send a video to juniorforecaster@local3news.com. Presented by Warren & Griffin, your local 5-star law firm.
Title Max got your money, your real money.